Hi, and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hi, everyone. Welcome to the Mindful, Beautiful, and Thriving series. My name is Annika Warrior. I will be your host today. Today is the first podcast of our Psychologist Off the Clock series. In this series, we will learn more about different psychology specialties. Today, we have Michelle Lee, who is an LMFT and an LPCC. Miss Michelle, would you please introduce yourself?
Sure. My name is Michelle Lee, as you know. I work in private practice as a mental health therapist at the Feeling Good Institute in Mountain View. And I'm dually licensed. So, as a marriage and family therapist and a professional clinical counselor, the L's stand for licensed. I see clients from young children through seniors. The areas I treat include depression, anxiety, bipolar disorder, and schizoaffective disorder. The main approach that I use is a form of cognitive behavioral therapy called Team CBT, but I also incorporate methods from many other approaches.
Yeah, that sounds great. Can you kind of walk me through a day in your life as an LMFT and an LPCC? I was specifically curious about whether LMFT and LPCCs work in inpatient or if they work in inpatient or in outpatient clinics settings most of the time. So if you can kind of talk about that and then also maybe talk about whether you work inpatient or outpatient.
Okay, so sure. On a typical day, I usually try to exercise first in the morning because I know the job is involves sitting a lot and also because I like to exercise. So I'll do like Orange Theory or horseback ride or walk my dog. If my clients are online, since I'm in private practice, I'll often work from my home office. Today I'm in the Mountain View office, and where clients have the option of coming in person, my schedule really changes. Like it frequently changes because I get people who start and finish, and there are periods where there are a lot of clients and periods where the business is kind of slow. But my goal is to do like no more than 5 clients a day. The appointments are 50 minutes, and there's preparation, and there can be a lot depending on the client, but most of it involves like reviewing the notes from the previous week, or if they're a new patient, going over a lot of documents that they filled out, and then they have to write notes afterwards. But I also work with children who, some of them, not all of them, but some are a lot less verbal. And I do also have some adults that are less verbal. And in that case, the preparation might involve like an activity. Usually, I use a lot of art activities in my practice. But I really have to think about like what's going to help the client. So I decide on a relevant activity it's designed to encourage relaxation, communication, and learning. And the learning part is centered on cognitive behavioral therapy. That focuses on the relationship between thoughts, emotions, and behaviors, and how to work with those relationships in a productive, positive way. I should say, I always take time for a light lunch. It's light because if I get too full, I'll be sleepy, and I don't want that to happen. And if I don't eat at all, if I skip lunch, I won't be able to concentrate well. The sessions themselves can be emotionally demanding because, people come to me with their challenges and their struggles. And I need to use my listening and empathy skills to understand my clients' experiences and also to build a trusting relationship. So that takes a certain amount of emotional energy and being present. So, yeah, my goal is always to try to finish my notes before the end of the day. To be honest, that doesn't always happen. But I would like to, the ideal is that I can go home and be with my family and my pets and be present with them. So you asked the question about, so I'm working in an outpatient situation, and the Feeling Good Institute doesn't, it's not a crisis organization. Like if you're in crisis, you wouldn't come here, you would go to the hospital or call 988. But LPCCs and LMFTs, I'm not sure about the exact numbers, but they can work in inpatient or outpatient. And there's lots of different kinds of jobs. Like some might be affiliated with a hospital or a specialized clinic or a community health center. So, and in that case, they'd work like a 9 to 5, sometimes a 9 to 5 job, or even longer. It just depends. So there's lots of different options for anybody looking to go into this career.
Wow, thank you.
So
Thank you. That gave me a lot of great insight. I was specifically curious about why you decided to choose this specialty. I I think that it can be very impactful and you're helping a lot of people, but I was specifically curious on how you knew you wanted to be an LMFT.
yeah, so there are mainly three options to getting licensed as a therapist in California, and that's the marriage and family therapist, the professional clinical counselor, and also like a licensed clinical social worker. The training and the tests differ in many ways, but to be honest with you, the jobs can often be very similar. They can be different too, like, but there's a lot of overlap. Maybe less overlap with the social worker, though. Although some social workers are doing exactly the same thing that I do. But I wanted to work. I wanted to work predominantly with individuals. However, individuals, exist within social contexts, and the family is very important. And I'm not talking about like, not only traditional families, but like family in this in a broader sense too, because there's lots of different kinds of family relationships. These, so when somebody in the family, like one person has an emotional challenge, a mental health challenge, it definitely affects that person, but it also affects everyone who loves that person, like their parents, their siblings. So when I those kind of challenges, I like the marriage and family therapist, the idea of it, because you're not only dealing with the individual, you're looking at this whole picture of people who are impacted. So like when one person isn't well, everyone else also struggles. So, yeah. So, and also, as later on, we could talk about this too, but sometimes certain mental health issues happen, like are are passed down, or they're very common, and or they occur frequently in certain families. So that's another reason why looking at the family is important.
Perfect.
Yeah.
Perfect. Thank you.
Yeah.
That gave me a great insight as well. Can you talk a little bit more about like family systems thinking and how it changes the way you work? And can you also talk a little bit about generational trauma and how that can impact individuals? And sorry, one more
So
thing I also wanted to touch on was an example of how different disorders can be kind of passed down through families. So if you can share a little bit about that, that would be great.
yeah, I just have, you mentioned the family systems thinking. Are you referring to there's a certain theory, family systems theory, or you're
Yes,
just
I
like in
believe so.
generally talking? Are you
Yes.
talking about that theory? So that's I believe that started like in the 50s, 1950s. It's a way of thinking about mental health issues that focuses, I would say, like on the interconnectedness of family members. So it's not just like the individual, like it's kind of what I'm talking about, like in some respects, where we're each of us is an individual, but we also impact the lives of other people, especially within our families. So, but with this kind of thinking, it looks at the family as kind of a system, like an organization with different parts working a certain way to maintain a certain way of functioning, which isn't necessarily the best way, but it will always the system will always try to keep the status quo. Any change or conflict or stresses impacts how family members work with each other and how the system as a whole works. So it's actually pretty complicated. I think I had a whole course on it. So I'm trying to simplify things here. So, but my biggest takeaway from that theory is not to, although I do focus on individuals, it teaches me to kind of put things, at least in my mind, into context and not just and not look at a person as an individual apart from other people. And then, and I think another way is sometimes, especially with children, parents will have their child put in therapy. That sometimes happens. And the idea that's called the designated patient, right? Like that's who you think is the person who has the problem. But it teaches you kind of like to look not at that person only, but look at the whole system. So I think that's really important with families. And that way, if the parents are doing something that is not helpful, you can work with the parents to interact with their children differently. So this is another big topic that you brought up is what was it,
Generational trauma, yes.
generational trauma, right? Where you can pass down certain, well, I mean, that's also very complex. So I think the first way to look at it is if one generation has gone through a very traumatic experience and has been impacted by it, like a war or an incarceration or something, or some kind of discrimination, they reacted in a certain way and had trauma, and that can play out in the way that those people raise their children and interact with their children. And it's not like it's not something like totally in their control. So if a parent was had a certain experience that made them like super anxious, it wouldn't be unheard of for the child to also have anxiety. And then the other thing would be just like the genetics too, like there's genetics there too, like if certain mental health conditions can be passed down genetically. That's a kind of an area that's still being explored a lot. So did you have something in mind in particular, like a certain kind of generational trauma?
Maybe something where one generation had, like, one individual from a family grew up with a lot of trauma and passed that on specifically to their children or something like that. I was always really curious about that, and I was kind of wondering like why that happens, and also from a treatment perspective, how do you kind of handle that and how do you provide the appropriate treatment for your patients?
Yeah. So I have worked with trauma patients, but I'm not a trauma specialist. So I may not be the best person to ask that question. But so, why is always a tricky question. But I'm sensing that it has to do with, it's not like a just happens, it just has to do with how the parent relates to the child, like, or how they react to certain things, because children learn from, first, not only from their parents, but first from their parents. So if there's like somebody who had a very terrible thing happen and they're anxious, then the child may learn that being anxious is a way to react to a certain situation. And sometimes, like, there are cases where sometimes, like, a behavior, like, let's say, let me think of an example. Like, let's say a certain kind of discipline, what we would call, it would be abusive and by our standards, but it was a certain kind of discipline used. And the parent never learns that that kind of discipline is abusive, that kind of negative behavior can be passed down. Or like, oh, my parents hit me, so I'm going to hit you, or hit you and hard, because it's not just hitting it, like if there's a bruise left or something like that. So there's things like that, or like sexual abuse or something like that, where it's normalized. The people don't know that there's something wrong with the behavior, and then it gets passed down. That's another way. But it's a lot. It's a big topic, and I think there's a lot of different ways. Or, I mean, I'm thinking of like, I mean, one of the big examples that people give would be like, you've heard about the Holocaust, right?
Right.
Where, right? So, like with the Holocaust, the people who survived went through, like mostly everybody they knew was murdered, right?
Mhm.
And they were threatened because of their religion and who they were. So a lot of the people, the survivors, some of them were managed to function well, but some of them, didn't function as well. I mean, they had trouble, emotional problems, and then the children grew up in a, like an environment where maybe the parents was super protective or couldn't really be happy, couldn't really relax. Like that could happen, like that kind of thing.
Got it. Yeah, so I think you brought up a great point as well about like the trauma that can kind of come with being an LMFT and, dealing with a lot of not necessarily directly working with trauma patients, but working with them in a sense where you hear all their stories, you hear how vulnerable they are, right? How do you kind of manage that? Because experiencing trauma or like learning about other people's trauma can have a huge mental toll on you, right? How can you kind
Mhm.
of, for high school students that are like nervous about that aspect of being an LMFT or working that closely with clients, how can they make sure that they're prioritizing their mental well-being as well?
Yeah, no, exactly. I've heard some stories where, like, especially when people talk about like abusive childhoods and things like
Mhm.
that, it's
Yeah,
so heartbreaking. You feel so heartbroken to think that this person went through this, I was mistreated in a certain way. And I won't, it's true. Like if I'm sitting with a client and they're telling me these stories, I don't just go home and it's I'm supposed to like divide my, separate my work from my personal life, but it's really hard. I feel very sad for that person. Sometimes I carry that pain with me longer than is healthy. So I guess the way I approach it, if they're coming to me and they're working on it, they're talking about it. For one thing, like with trauma, one of the most important things I think is a narrative. Like when people can talk about it and make it into like a story, this happened to me, then they start to heal. I think what the pre-healing is like when you can't even talk about it. Like it's so painful, or you can't, sometimes people don't even remember things. But if they can come to me, and I don't have like, I usually get people who they're doing, most people are doing relatively well, right? If they come to me and they're telling me a story, that that tells me that they're processing what happened to them. So I can feel good about that. And I can feel good that they trusted me with their story, because I don't take that lightly either, right? If somebody opens up to you something they've never told another person or rarely told another person, that's an honor, really. That's that they trusted me with that. So, and then the other thing is, with the method I use with Team CBT, it's kind of like, how is the person, we can't go back. So there's two things. One is there's a certain acceptance that has to happen. This happened to me. We can't go back and change what happened, but it's really important to look at, like, how is that experience, that terrible experience, impacting the person in the moment? How do they feel about it? Right? Because that's
right,
where the change is going to take place.
for
Like
sure.
if, right?
Mhm.
So I guess I get focused on like, how trying to figure out, what is this trauma holding the person back? Because it doesn't always. Sometimes there's something called like growth. There's a kind of growth that can happen with trauma too, right? So
Correct.
what's happening? Are they stuck or are they moving forward? That kind of thing. And if they're stuck, then it's my job to sort of help them or support them getting unstuck. But
Yeah.
yeah, I mean, the truth is that, terrible things happen to some people, a lot of people. So but for, hopefully, I mean, I guess for a high school student, let me think back. It's harder because, you're young and you haven't heard, there's a lot of things you haven't heard yet. If somebody came to you with a traumatic story, like your friend or something like that, I think you should talk to an adult, and talk about like, oh, so and so said this, maybe your parents, maybe they have a therapist. Like it's something that I don't think a high school student should carry that weight themselves, that's a lot of weight, depending on what it is,
Yeah, for
right?
sure.
Because, right?
Yeah. I
Um,
think I think there's working in the mental health space can come with a lot of burdens that people unfortunately have to carry sometimes, and it can be very hard because based off what I've heard. But I think it's such a rewarding profession because you're really helping so many people. So, yeah,
yeah, and I think that's what you have to tell yourself, that you're there for a reason, to support them, and they to teach them, how to grow better. So kind of like, without being like, oh, I'm the hero, I don't do that, but like, to know that like you said, like you're helping.
right.
Yeah.
For a student interested in maybe pursuing a path as an LMFT, what would you recommend that they do in high school to kind of like better prepare themselves and kind of dip their toes in the water a little bit? And also, who would be a really good fit for this? I think
Okay,
a
so
lot of our viewers right now watching feel a little bit unsure about the field of psychology because it's such a broad field of study, and there's a lot of things that they can do with it. So if they're interested in studying to become a LMFT, what would you recommend they start doing in high school to like better their knowledge about this field? And again, who would truly be a good fit and really thrive in this role?
I think the main to be a to be a therapist, it doesn't, like, a good therapist, it doesn't mean you have to have gone through everything that every client has gone through. That's impossible. But it's important to be a really good listener, and also to be able to provide empathy, to be able to put yourself in the other person's shoes, so to speak, right? So I think this is kind of general, and I don't know if it's really what you're looking for, but of course you could read about, all the different theories and stuff like that. But I think more importantly, it's a time of your life where to make an effort to learn about people, like different kinds of people, and not necessarily like people like yourself, like all, different people struggling, different backgrounds. And if you get the opportunity to listen to their stories, and when you listen to people's stories and people telling you things, or even if it's like, even like television show or something, like, to not judge, because I think that I'm not saying you would like, oh, I'm not going to judge and I'm going to do everything they do, not like that, but like, try to hear their stories from a non-judgmental perspective, like without being like, oh, they shouldn't have done that, or that's a bad person, or you try to see from their point of view. For me, when I was young, and I became a therapist much later in life, it's a second career, so it helped me a lot to live, to go through a lot of experiences. But I don't think that I know a lot of young people who right out of college become therapists, and they're great therapists. But for me, I was a big reader of literature, and this may sound strange, but it's actually, you read, like, you only get once your life story, right? Others when you read books and you read literature, you get to learn about other people's stories and other people's lives. So I would highly recommend, like, reading widely, reading literature. So slowing down, listening to people, learning about, like, I was always into other, like, interested in other cultures. I studied Japanese culture for a long time, to learn about other cultures, all those things. It's not like you all those things teach you about life and about people. And I think that's actually the most important thing. It's even more important than like the book knowledge, because you're going to get the book knowledge. If you're going to go in that career, they're going to make you read the books. But in high school, I would just try to be curious and open, and, you know, well read. And then I guess you could, like, if it's possible, if you really want, like, to work in, if you're working in the summer or volunteering or something like that, if it's something that involves people, like a camp counselor, or you volunteer in a senior citizen home, like, I'm not sure what kind of opportunities are out there right now, necessarily. But if you could, anything that brings you closer to people and listening to people, and even just if that's not possible. I think what happens a lot of times when like high school and college, you're with your peers a lot, right? You talk to your peers, and that's obviously that's normal and everything like that. But if you get the opportunity to like talk to somebody from a different generation, like if you're, lucky enough to have your grandparents to listen to their stories, so you can, learn from them, even though their lives were maybe totally different, but to open up and listen to stories of other generations, I think that would be helpful. But I don't think you necessarily have to like, I'm not going to give you a book list about
Mm.
being a therapist, right?
Yeah.
And who would thrive? I actually don't think there isn't one. Obviously, there isn't one good type. Obviously, there's you have better to be a good listener, better to care about what other people are going through, and if you're able to put yourself in their shoes, those are all good qualities to have. But think about it. The potential clients are all different types of people, right? So there might be certain people that come to me that aren't a good match for whatever reason, right?
Yeah.
Like, so I would encourage, like, if you're interested in it and you think, oh, maybe I'm not the right kind of person, I would don't worry about that, because that you will find the people that that you can treat and help well, I think. Um,
Yeah.
so yeah. So
Yeah, thank you. I loved hearing about the right people or who what kind of skills would make a really good LMFT. I was a little bit I was curious to see like who LMFTs really collaborate with. Do they work with psychiatrists? Do they work with like a whole bunch of mental health professionals? And I was kind of just like curious on like how how they work with others and how much of a role do they play in or how much do they collaborate with other mental health professionals specifically?
yeah, so in my experience, I would say the I do work a lot with psychiatrists,
Mhm.
especially, well, not especially when somebody has a serious mental health condition that requires medication, right? Because I need to, if something, because medications don't, things can go wrong. I need to be able to call like the psychiatrist. You get like a release of, I think you can talk to the doctor anyway, but I always get a release of information signed. So I like to collaborate with psychiatrists because I think they're very important. They're also treating the client, and there might be things that I need to know. Sometimes I will talk to psychologists, because although I do diagnose, many psychologists are more trained in diagnosing things. So if, let's say, like, so for example, um, I can usually see, let's say, if someone looks like they're showing symptoms of autism, but I wouldn't diagnose them myself because I don't have a specialty in diagnosing autism. So in that case, I would give them to like a psychologist who has trained in diagnosing that person,
Got it.
right?
Yeah.
So that's really important. Like referrals, I'll give referrals.
Right.
And then the other thing that we do is we have consultation groups, and we don't like reveal the identity of anybody, but if we're stuck on something, um, we can talk like in general terms, like I have this kind of patient and I don't know what to do here. So we help each other a lot. Um, we help each other when we get stuck or we have some question, or once in a while I get like a client that maybe they're something I don't understand about their background because I've never encountered that before. So that would be the three main things. And then this is not mental health, but sometimes I talk to doctors, like if there's something
Something. Yeah.
relevant. It kind of all depends on like what's relevant.
Got it. So you mainly
Yeah.
collaborate with a lot of different people. Yeah.
Different people. I would say psychiatrists are probably the big one, because I work with, like certain conditions that require people to take medication.
Got it.
Yeah.
I was wondering if if you can just briefly talk a little bit about a specific moment when you knew that this job was was the right fit for you and you really made an impact on someone. Just like maybe tell me a couple of things or just a specific moment when you really felt touched and really felt like you made an impact on a client.
I think, um, so, okay, this is a little tricky, right? Because I can't give out any information, but I think one of the most rewarding things for me is when somebody has had something in life, like some kind of mental health break, and they kind of fall off the track, right? Like
Mhm.
in this area, like, you go to high school, you go to college, you get your job, like there's a certain track, right, that we're kind of taught that we're supposed to do. But the reality is that not everybody follows that track.
Mhm.
So the rewarding thing to me is when somebody gets back on a track and
Yeah.
is functioning and doing what they want to do and enjoying what they want to do. So that's probably the most rewarding thing
Yeah.
for me to see. Yeah. And also, I think, yeah, somebody who, if somebody's really depressed and suddenly you see them laughing and being happy, like that's awesome.
Yes.
Right.
Okay. Thank you so much. We will be ending our podcast here, but um, I would like to thank Miss Michelle for joining us here today. I learned so much from you, and I hope that our viewers learned a little bit more about what it looks like to be an LMFT and an LPCC. Miss Michelle, would you like to say anything to our viewers as we wrap up?
Um, no, I'm very touched that people are, looking at this career. And I think it is, very rewarding. And, if you have any questions, feel free to reach out and ask them.
Okay. Thank you so much, everyone.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every month, so make sure to continue to check those out. We hope you enjoyed this podcast, and we thank you so much for listening.